Think you're allergic to penicillin? Pharmacist explains why there's a good chance you're not. I'm allergic to penicillin. You've probably said it 100 times. At the doctor's office, before surgery, even on a first aid form at summer camp. But what if that single sentence has been steering you toward the wrong medicines, higher medical bills, and even antibiotic-resistant infections for years? Here's the jaw-dropper. Roughly 1 in 5 Americans insist they're allergic to penicillin, yet fewer than 1 in 100 actually are. That means millions of us are walking around with a scarlet letter P on our medical charts that we never earned. I'm Elizabeth Covington, a clinical associate professor of pharmacy who spends her days studying antibiotics and drug allergies. I've seen firsthand how a casual, "I think my mom said I broke out once," can snowball into decades of. Let's rewind to 1928, when Alexander Fleming noticed mold juice killing bacteria in a petri dish. That happy accident became penicillin, the grandparent of modern antibiotics. Today, penicillin and its chemical cousins, amoxicillin, augmentin, and others, remain the go-to drugs for ear infections, strep throat, pneumonia, UTIs, and even some dental abscesses. They're narrow-spectrum sharpshooters. They hit the bad guys without carpet bombing your entire microbiome. But slap an allergic label on a chart, and the script flips. Doctors reach for broad-spectrum antibiotics, bigger guns that mow down good bacteria along with the bad. That collateral damage fuels antibiotic resistance, drives up costs, and can leave you battling side effects like relentless diarrhea or a stubborn C. diff infection. So why the mismatch between perception and reality? Childhood is the biggest culprit. Picture a toddler with a virus who develops a rash on day 3 of taking amoxicillin. The virus, not the drug, often causes that rash, but the electronic health record immortalizes PCN allergy forever. Nausea, headaches, or an upset stomach after antibiotics get filed under the same umbrella, even though these are side effects, not allergic reactions. Family lore plays a role too. If Aunt Linda swells up like a balloon after penicillin, well-meaning parents may forbid the drug for everyone at the Thanksgiving table. Yet penicillin allergies aren't hereditary. You don't inherit hives the way you inherit eye color. And here's the part most people miss. Even if you once had a genuine allergy, there's an 80% chance your immune system has moved on after 10 allergy-free years. That's right, your body can outgrow the reaction, but your chart rarely updates itself. Why should you care? Because believing you're allergic when you're not can push you towards stronger drugs with harsher side effects. Increase your risk of post-surgical infections. Lengthen hospital stays and inflate medical bills. Rob you of the safest, cheapest, and often most effective option for common infections. Ready to find out if you're truly allergic? Start with a conversation. Your pharmacist or physician will play detective, asking questions like, what exactly happened? How soon after the first dose did symptoms appear? Did you need emergency treatment or just a little Benadryl? Have you taken any related antibiotics since then without incident? Often, that chat alone clears your name. If doubt lingers, 2 evidence-based paths exist. 1. Penicillin skin testing. Tiny pricks and shallow injections introduce trace amounts of penicillin components under medical supervision. No reaction? You're probably in the clear. 2. Direct oral challenge. Skip the skin test and swallow a small, supervised dose of amoxicillin while staff watch for 30 minutes. A 2023 study found this streamlined approach just as safe in many patients. Both methods are quick, office-based, and can turn a lifelong no penicillin into a green light for better care. But here's where opinions diverge, and I'd love to hear yours. Some clinicians argue we should automatically delabel anyone whose reaction happened more than 10 years ago without testing. Others insist on formal skin testing for every single case. Where do you stand? Should we be more aggressive about challenging old allergy labels, or is caution still king? Drop your thoughts below. Have you or someone you love ever discovered a long-held allergy was bogus? Would you take a 30-minute challenge dose to reclaim first-line antibiotics, or does the mere idea make you nervous? Let's get the conversation and maybe a few friendly debates rolling in the comments.